If you don't mind, just start with your name and your title.
Yep, I'm Marissa Nunes Moreno. I'm a clinical psychologist and the director of the mood specialty program here at Children's.
Can you tell me what the mood specialty program is?
It's new and developing. The mood specialty program really focuses on mood disorders. So anything across kind of the spectrum of depression, bipolar disorders, and creating treatment services for those youth, which happens to be one of like the biggest kind of referral areas that we have. And so trying to create groups and other services beyond just individual therapy to meet the needs of these youth, and also different levels of care. So right now, kind of thinking about not just individual therapy, but what's between individual therapy and partial hospitalization, and creating some services for youth that fall along all that trajectory.
What's the age range of patients that you see?
Great question. I would say that we see children across all ages. Younger kids tend to present when there's maybe some mood things going on. They tend to present with externalizing behavior. So it could be temper tantrums or big meltdowns. So sometimes they typically go to some of our early intervention folks who have really great interventions like PCIT, focused on like parent and child interaction and really improving some of those behaviors. I think we start seeing more youth in our program when we hit that kind of middle school range, high school. I think we tend to see more of those kids as they get a little bit older, when it's that shift between parent play and parent intervention to, yes, parents are involved and these youth can kind of participate in their treatment in a more advanced kind of way.
What does your day-to-day look like?
Day-to-day looks like, could be a number of things. I think part of the day is planning how we can roll out some of these services for youth. Some days it's direct clinical care. So among our mood disorders team, we practice a lot of dialectical behavior therapy, which is fancy word that means a conglomeration of a few therapies. Some cognitive behavioral therapy, so how we think, how we feel, how we behave. Mindfulness, we've heard a lot about mindfulness, right? In the mental health world, there's aspects of being really interpersonally effective, learning to manage emotions. And so my intervention time when I'm with patients is there, or it's meeting with our consultation team, working on cases, making sure that we all have like education and ongoing practice kind of in this area. So those are some of those big pieces. It can also be teaching, presenting. So every day is kind of different, and it has always a mixture of some of these different things. Collaborating with folks here to think about how can we roll out services and increase access for families. I think that's one of the biggest pushes, especially with like the mental health crisis that is just continuing, is how do we increase access? How do we make sure we think about our families in Colorado that are in rural Colorado too?
You mentioned the mental health crisis. I'm curious how long you've been in this role that you're in and what has changed since you've been in this role.
I've been here at Children's, I was here for my fellowship, which is like this weird year between graduating with your doctorate and being fully licensed. I was here for 2018 to 2019, and then I left for a year and came back and was able to get a position. So I've been here with children since 2017 and kind of living in Colorado full-time since then. Oftentimes seeing really similar presenting patients to what we see now, but there just wasn't this formalized role actually until beginning of this year. So it's really new kind of being in this formal role. And before it was doing all the same things and kind of just struggling a lot with colleagues of like, how do we get people the right care, and having to refer out because we didn't have higher supports other than being partially hospitalized. And so I think being in this role, it's been recent, and it might be a little bit kind of subjective or anecdotal, but I don't know that I've seen a lot. I think it's continued, right? And if not, has maybe even the trajectory of that mental health crisis, like anxiety and depression, has continued to be increasing, and I don't know that I see anything different in our clinic.
What's the most pressing concern that you have as a result of your work?
I think in the field I work in, I'm predominantly really concerned about youth suicide rates. While that's not all of the youth that we see, right? It is the population that I worry about the most, are those who have really high acute mental health problems. And sometimes that shows up as really low depressive, low hopelessness, but sometimes it's also really emotionally reactive, emotionally dysregulated. I worry about those young people, the ones who are in and out of the hospital, like going to the emergency room or inpatient. On top of that, I worry about those who are really having a hard time with their parents, right? So parents having a hard time knowing how to support, or in some cases, which is not all cases, parents who really aren't, able to be available or supportive to the young people. I also worry about, we know there's lots of mental health disparities. So we know that youth from marginalized identities of a variety of type are at greater risk because they're not only managing like whatever mental health might be going on, whatever biological genetic components there are of that, but they're navigating systems and aspects in the world that are not treating them with equity. And so I think those are youth that I really, really have concerns about.
The socioeconomic disadvantage due to systemic racism, lack of access to services, due to institutional discrimination, just touching on that a little bit more because you did such a great job already, but we definitely want to talk about that in this program.
Yeah, absolutely. So thinking about those health disparities, right? And we know that folks from marginalized identities, whether that's across race, ethnicity, gender, attraction, diverse gender identities, so our trans and non-binary youth, that there are really big disparities where they're highly impacted by environmental stressors, right? And these can be really traumatic stressors, adversive experiences growing up. They're faced in a community where there is systemic racism, where there is discriminatory policies that are in systems, that are in schools, that are in communities, that there are socioeconomic disadvantages that marginalized families are often exposed to. Do they have access to community centers? Do they have safe places to play outside? Does their schools get the funding that they should equally have as kids on the other side of town? And so we know that youth can be highly disproportionately impacted by that.
How does one meet criteria for a mental health disorder?
I mean, one of the biggest things that we're looking for across, we use the Diagnostic Statistic Manual, and there's a number of mental health disorders. And I think the one thing that really connects all of them is this thing like functional impairment, right? Are there these problems happening to an extent that they are getting in the way of life somehow? So whether that is social relationships, the ability to do your day-to-day life tasks, the ability to have access to your education and school, to be able to do extracurriculars, that is the thing that really kind of tips the scale of, does this person meet the threshold of a mental health diagnosis? Is it getting in the way of their life?
Can you talk a little bit more about the various factors such as biological markers, environmental triggers, and inequitable systems that are considered when it comes to youth mental health?
In the kind of clinical way that I practice, we often use like a biological kind of social way of like looking at folks, right? So biologically, right, we all have genes, biological kind of markers that make us maybe more sensitive to emotions, more reactive to emotions, right? If we think about babies, there are some babies that are born, they really haven't had a lot of external input, and some babies have a temperament where they cry and cry, even when they've been fed, even when they've been changed, even when they've been cuddled, they cry and cry. And others, they're really content, right? There's these biological things that are here from the moment babies are born, right? That are some, that I think that's one example to kind of outline like how, we come into the world. It's not always social things. So we come into the world in our own biology, right? And some of us feel emotions really sensitively, almost like if you had really bad like seasonal allergies, right? Like you might be crying and someone might be crying and kind of like having a lot of snot and itchiness, and the person next to them might be just fine. In the same way, we can be kind of emotionally more sensitive, right? To feeling things, not just a little blue, but deeply, profoundly sad, or not just a little nervous, but profoundly anxious. And it could also impact how we react to things, right? Are we someone who has a really strong reaction? And do we act on that really strong urge, right? So is that yelling at someone, running away, slamming a door? For some of our teens, it's hurting themselves, right? And so that's kind of that biological piece. And then we have the social pieces. And so those social pieces are how we interact with the world, right? How does the world interact with us? It could be family members and parents, often the first people, right? This can be schools, preschools, coaches, folks at church, really anywhere in the community, and it can get bigger than that, right? If we think about school policies, is this a school that really manages like things like bullying? Is this a school that manages things like really promoting inclusivity. Then we look at bigger policies, right? Are there policies that protect students, that protect young people, create equity, create access? So it's kind of like all those social things that interact with someone can interplay with someone's emotions. So on a kind of coming back down to like a family level, right? If you have someone who's really emotionally sensitive, really reactive, right? They feel things really strong. These are the kids that we go, it's just spilled milk. Why are you crying? It's not that big of a deal. But it is such a big deal, right? And what that does is it draws us as adults, even adults who mean the absolute best for them, to go, hey, it's okay. Why are you crying? It's not a big deal. Trying to help it, but it can be deeply invalidating, right? And that's like one little example. As that gets older, it could be I failed a test and I'm a failure and I'm not going to go anywhere and I just can't. And a parent saying, it's okay, you'll get it next time. You'll try harder. Don't worry. Still can feel really invalidating, right? Or, hey, there are way worse things in the world. Really unintentional things can have this interplay between kids who really do react in strong ways. It pulls from the environment to say, hey, like that's not that big of a deal, which if anyone's ever been told, what you're feeling isn't a big deal doesn't usually calm us down. It usually upsets us more, and it can create a cycle over time. And so I think there's these interplays, but for those youth who have identities and have marginalized identities that are invalidated through interactions, through assumptions about them, assumptions that they're up to no good, assumptions that they've done harm, assumptions that they're not trying hard based on whether that's race, ethnicity, again, a number of identities you can imagine. For folks who have disabilities, maybe being disregarded or dismissed, all of those things add to that cycle of being invalidated, and that can be internalized over time. And that comes from big systems to individual people's biases, which are impacted by those big systems, and it impacts those young people. It's a really long answer, but...
Fantastic. Thank you so much. How did we get here? Can you help? I know this is long and it's hard, I'm sure. And it's...
yeah.
How can viewers maybe begin to understand sort of the landscape of youth mental health issues and how they came to be? And we've been talking a little bit too about like, have we always had mental health issues and it was so stigmatized we weren't able to talk about it, or we didn't have the appropriate resources and access, and so but now we're starting to understand it more.
I mean, I think you're absolutely right. I think that's a great place to start of like, how did we get here and how do we come to understand this? I think a great place for adult viewers to start is to think about their own upbringing. How was mental health talked about, not talked about growing up? What was it like for their parents? And I think what we see generation after generation is not talking about it, to a generation that maybe noticed some things, but you still don't talk about it. A lot of stigma, right? A lot of stigma. That can be very different too, especially depending on culture of origin of families, religious origin, right? There are some, in some like religious groups, it's not really mental health, it's having a strong enough faith, right? And that can impact folks and kind of lead to not talking about things. I don't have it exactly, but I remember seeing rates of even like pastors had really high rates of suicide and depression. Can't talk about things. And then if you're a leader, there's another piece, right? So it's these kind of through generations over time, I think there has been more conversation. And I think that's changed how people parent, how people approach youth, and that stigma's not gone. I think even for this younger generation, I'm sure we'll talk about social media. Social media, it's a gift and a curse, right? And I think one of the gifts is it started to help destigmatize and normalize and talk about some of these things around mental health. And there's still a lot of mental health stigma, even in this like current generation of young people. And I'm guessing that again has to do with differences of where they come from, who has the ability to talk about mental health, what families do they come from, who can afford mental health, who can get access to mental health. And so I think that stigma is still there. And I think the first place we can start as adults is we can start to wonder like, hey, what was it like for me? And did that serve me well? Yeah. Probably not, right? And so how do we start to maybe think about our context there? And youth are still going through a hard time. And how do we kind of come to understand and take them really seriously in their mental health? And then, of course, this generation has faced things I didn't face, right? the COVID pandemic and being in school at a really critical period. And so mental health is here, and I think this is how we've gotten here, is the stigma, the continuation of policies that are inequitable, that are harmful, the disparities in mental health continuing, right? But whether it's between classes and like socioeconomic status or having access to various things, it's just been kind of the snowball, I think. And then I think the pandemic really hit something that was already snowballing and kind of made it even go down a faster trajectory. Yeah.
You mentioned social media, and there's one thing I want to touch on about, there are kids who are really struggling with mental health and have some quite severe mental health issues. Yeah. And then there are some kids who are self-diagnosing via TikTok, who some of them might be absolutely getting that diagnosis right? But then some are sort of organizing an identity around that mental health disorder that they haven't even necessarily been diagnosed with.
Yeah. How
do you make distinctions between the two as a provider?
Oh, what a good question. So when it comes to social media, especially things like TikTok, where there's just the ability to connect to more people, hear more people's stories, on some hands, I think it's been really helpful for folks to maybe understand aspects of their identity. When it comes to mental health, there are some people who I think have come to recognize, wow, like this is me, right? So we have this history of folks in my generation, especially folks who are assigned female at birth, socialized as female, identify maybe as women through their lives, who got missed when it comes to autism, right? Because automatically they're socialized to engage in like masking behaviors, hiding the autism, right? Being able to kind of mirror and pretend to be able to engage in social ways that actually don't come very easily or naturally, but can pick it up. And it's not until adulthood that they're getting diagnosed and finally going, oh my gosh, my whole life, like that wasn't my fault, or that was actually harder for me, or that wow, right? And so we have folks who maybe are recognizing these things at a younger point where we can look into it and we can intervene. And there's a lot of, recognizing things and that not being quite the case, or things on TikTok. I'm on all these TikTok things. Being in mental health, it pops up on mine. This is a sign of ADHD. And I'm like, no, sleeping with your arms in that's not a sign of ADHD. And so there's this great kind of more information and knowledge, and it's kind of hard when someone's really put their heart on that and said, this is it. And as a provider, you kind of recognize maybe it's not. And I think where you start is, what do you see in that feels like you? I think we can move past maybe that clear diet. What do you see in it? What does it mean to have that name for it? What if I said, yeah, there are some of those things, but I don't quite know if it like meets this full kind of threshold, but maybe there are some of these features. And so kind of meeting someone to say, how do we shift that? And then how do we also work towards, let's not have an identity maybe honed in on like a mental health issue. And for some people, mental health is mental health. For some people, there are aspects that are identity, like for like the community of folks with autism, right? There are some autistic folks who that means a lot to be able to connect and have community. So I don't want to also like dismiss that, right?
What role do you think that smartphones play? Yeah. Especially for young people whose brains are still developing.
Yeah. I mean, having access to smartphones, not just for young, I think for all of us, we have a lot of access to screen time, right? It's impacting our eyes. It's maybe impacting, there's a lot of avoidance that goes into scrolling, right? And I think that's for young people and adults alike, it is a quick and easy way to tune out all the stressors. And it's very easy and accessible when we get that urge of like, oh, I don't want to do this thing. I catch myself all the time picking up my phone and being like, wait, no, I actually need to like work. And so there's this plethora of access to screens and screen time just by having the device, right? And that can impact attention, it can impact sleep quality, it can impact our physical health. So that's like one huge component, right? Especially if it's in too much access. Some of that kind of the other side of the curse is there's this access to social media and other people and really like these idealized pictures and forms of like people that can really impact self-esteem, can impact body image, these constant comparisons that teens can make themselves to others, and we know that these things are not realistic, right? And we see kind of from like my generation was like millennials and like how many likes did you get and didn't get, and now it's like transformed to something way more intense, and it's constant. And so I think this can have a really big impact on young people. And then the idea of like cyberbullying, right? I read something somewhere of like cyber trauma almost, of kids can go to school, have to deal with a lot of hardships, and there's a lot of cruelty, whether it's like people at school targeting them or just being on social media and people saying horrendous things about them, because there's that anonymous nature that people can say things that they would normally never say out loud, but they'll say it on social media in an anonymous way. And that really does impact young people. That kind of, we talked about that biological kind of social environment piece. Those young people who've had those experiences, it hits them hard and they take it to heart, right? So I think those are some of the biggest concerns I have when it comes to social media and screens.
When we were younger, when we tripped and fell in the hallway, it was like,
my gosh,
people would laugh at you, and it felt awful. But now you run the risk of people pulling out their cell phones and then posting it on.
Or let's talk about with AI, right? And like creating modified pictures of people who don't have their clothes on, right? Like really, I think all the time, like, oh my gosh, I'm so grateful I didn't have, I wasn't on TikTok or these things at this age. Like, no one's going to find my MySpace. Thank goodness. There's this, it's really hard to escape from those things. And I remember in older generations, I'm talking about, don't put things on. Everyone at work's colleges are going to see it. And we kind of were like, oh yeah. Now, like, stuff is everywhere, right? And it's saved in this abyss of like data. And I would say that I have seen that in like the kids I work with, that the way that they are spoken to, especially those who have identities that might be targeted, it's really impactful. And thinking about the young people who really isolate to find community online, again, blessing, and they could also receive some of this really awful input, and that is the only place that they're able to access relationships.
Why is it important to have access to trauma-informed therapy for young people?
Yeah, I mean, gosh, I honestly think it shouldn't even be something that we say is separate from therapy at this point. All therapy needs to be trauma-informed therapy. All care needs to be trauma-informed. You can't really separate the two. I think we have a name to it, right? And so now we can kind of say like, hey, are we really being mindful and thoughtful of this? And I think that goes, gosh, you can't even have trauma-informed care without having a good understanding of like, things like racism or things like discrimination. Like they are all hand in hand, right? And so it's really recognizing that the people that you have coming to see us, not just me as an individual is one level, right? What is their interaction with me based off of like my visible identities, right? And their experiences growing up. Is there a lot of fearfulness of providers? Is there a lot of, have they been kind of disenfranchised and disempowered, right? Also important for bigger systems of how do we create policies and practices and procedures, knowing that like we have families coming to us that have been disempowered and disenfranchised by big health systems, that avoid care because of how they might be treated, that are coming to a place that might be dominated by particular identities of providers, whether that's men, women, folks who have like white or non-white identities. Like, I think being trauma-informed, it's kind of impossible to engage in good care without being trauma-informed and recognizing the traumas, if we're talking about direct traumatic experiences in life growing up, but also these systemic problems that people are impacted by. You can't do good care.
Why is prevention and early intervention so important?
Like when you hear you say it, it almost feels like obvious, like, well, why wouldn't it be? But prevention, like early intervention, like early diagnosis of like, hey, there's something here, like detecting things early is critical. And it can be the difference between someone just having a mild depressive episode and getting to places where it gets really severe and really need help. Again, in a world where there's a lot of stigma, depending on the culture in which like a child is around, is it okay to talk about? Is it not okay to talk about? Are they going to ask for help? I would say young people most often aren't, until it gets to that place where all of a sudden adults in their life are going, oh, I see something's wrong without a doubt. This isn't just a little blue, like something's happening here. So that early detection is really, really important. And we're seeing more of that in like primary care settings, which is amazing. We know when someone's going to come to ask for help, they often go to their primary care provider, and people are more likely to see a primary care provider than a mental health provider. So it's a really great opportunity to be able to do a screener, quickly assess and connect to resources. And so seeing that increase in primary care has been a really big positive, I think, over the years.
So you were just kind of talking about this. What should parents consider as red flags when it comes to their kids' behavior, and how do you know when you should actually worry about your
Oh, what a good question, right? And I think that line can get a little bit hard to know, right? And so when we think about early childhood, yeah, it's probably typical for kids to have a temper tantrum here or there, right? To get upset about something that to us seems logically like really minute. And if something is like really repetitive, right? That a kiddo really can't transition from one thing to the next without having a total meltdown, or is behaving in ways that are maybe like aggressive, or hurting themselves. Like those are like clear times where it's time to get help. If kids seem like not just sad, like in one moment and they recover, great, like, right? Like, but kids who seem sad and they have a hard time recovering, they have a hard time co-soothing and co-regulating, and it seems to be kind of persisting. Those are times for young kids that we definitely want to get support. Teenagers, I would say similarly, like it's normal for teenagers to maybe spend some more time in their room and kind of have like solitude. That's different than isolating, right? And when we see a multitude of signs, isolating plus maybe not really eating anymore, being late to school, having a hard time getting up, maybe irritability and like lashing out at parents over maybe something that really didn't seem like a big deal, more than just kind of a little grumpiness here and there. But again, we recover, we soothe, kind of that kind of more drastic changes, big things too, like engaging in like behaviors that really like repetitively are like maybe risky, things like self-harm. Those are things where it's clear time to get help. But I would say when there's a multitude of factors and it's lasting, it's not just I was sad one day, but okay, I'm back to normal. I can be with the family, be happy, but you start to see some of the patterns, and I think those are times when it's important to get help.
Are young people coming in with suicidal ideations than there used to be?
We're seeing increases over time in anxiety and depression. I certainly think that probably suicidality is probably part of that. I mean, we continue to get kind of these big surveys, right, from whether they're national or, these big adolescent surveys continue to show rates of suicidality, or ask questions like, in the last year, did you think about wanting to end your life? In the last year, did you try? In the last year, did you feel like you needed mental health support? How many got support? And we're still seeing trends of, there's still suicidality, absolutely. There's still high rates of depression, youth who aren't getting access to care but would like access to care. I think there are some things we're starting to get right. I think not overall, and I think we're continuing to see like schools adopt more kind of a lens of mental health, and having counselors on site and having folks really be there to like support kids. Every once in a while I'm hearing about really cool, almost like mental health oriented groups at school. They're like peer-led support groups. Like I'm hearing more and more about some of these things. I don't think it's widely across the board. Is it accessible to every single kid? Not yet. And that's where I really hope we get to. And I think it seems like mental health is being taken more seriously in some spaces, and that's really hopeful, and I think it's the right direction to go. And gosh, I hope that's a sign of it, that we're on the right track.
Do you feel like youth these days are more accepting and willing to discuss and disclose their mental health disorders? And if so, why do you think that is?
I think it depends. Funny thing is I asked my kid this question yesterday, and and she's like on the YCMH team here of like youth who like are really advocating for mental health. And I think it depends on where, right? Who has access to things? What is like the predominant makeup of the peers that they're around? And is that a space where there's a lot of stigma on mental health? I think there has been an overall shift. But I do think like who gets the privilege to be able to talk about mental health without being shut down or dismissed, I think is a real thing. And I do see more youth getting involved in mental health and getting involved in advocacy. And we can see as we create these programs, it's really powerful, right? So even thinking about the Youth Council for Mental Health here at Children's, we see how like they're identifying these youth to bring into these leadership positions, whether for advocacy, leadership, and youth have a lot to say about mental health, and they understand the context and they understand the experience of their mental health, their peers' mental health, better than any adult maybe will understand what it's like right now to experience social media and be in their schools and to go through COVID in ways that I don't know that I'll ever fully understand. And we have to listen to them. And I think there are some young people who really are stepping in and advocating more. And those are probably young people who've been impacted by mental health and are finding a way to use their experiences to advocate, to create change. And I think those are pretty remarkable young people.
Can you talk about the role of medication in treating mental health issues in young people? Are we over-medicating? Are we under-medicating?
I think probably all the above occurs in different places and spaces, right? I think there could be some places that are under, some places that are over. And I think what's important to remember is sometimes medication really is extremely important to treatment. There are some mental health conditions where medication is it's the first line of treatment, in fact. And that's going to be really important. I think ensuring that we diagnose accurately, that we're tracking and monitoring young people accurately, and that we're having collaborative care is really important to ensuring that we're medicating young people, not just under, like we're not wanting to be under or over, but we want to be correct, and we want them to have the correct medication. So how can, mental health providers who are doing weekly intervention provide information to psychiatry providers who might see young people once every 3 months, what that monitoring and ongoing time is. So how do we work collaboratively? How do we hear from what's going on at school and from parents so that we're diagnosing really accurately and being able to utilize medication in a way that's therapeutic and helpful? And so I would say medication is central, it's critical, it's important, and being really responsible, of course, is always going to be important, and wanting to strike that balance. We don't want to over-medicate kids. We also don't want to under-medicate kids when there's something important going on.
Great. Is there any merit to the concept that we are perhaps coddling youth and introducing mental health subjects, maybe as adults, but maybe also via social media and what they're taking in through social media, and then doing that in a way that may suggest that mental health struggles are something that will inevitably affect them. And then they sort of, some of them maybe perhaps put it on sort of as a badge of honor.
Wow, what a question. I think as humans, as adult humans, I think a lot of times when there's something happening, we often react with fear, especially if it is something that scares us, right? So we know for a long time, and for me growing up, suicide was something that you just don't talk about, right? There was this fear of, if I talk about it, I'm gonna instill this and maybe they'll act on that more, right? And we still see this. We actually know the opposite is true, that talking about suicide is protective. I think similarly, this is in the same place that we're at, is talking about mental health doesn't bring on mental health problems. And I think we can be mindful and thoughtful about how we talk about it, right? The difference maybe between everyone's going to have a diagnosed severe mental health problem, some people might, versus everyone's gonna face stressors in their life. And how is it important to know when those stressors are stressors that come and go, right? Big test is coming up. Oh, I feel nervous. For 4 days before, I'm not sleeping well, my stomach hurts. I take the test. Oh, I feel better, and I'm going on. Stress. really normal part of all human life. I took that test. I'm still stressing. I can't let it go. I can't stop sleeping. I keep thinking, what if? And then something else happens and I'm what if on that. Well, it's important to know when, hey, that stress is actually hitting a plethora or hitting a threshold of this is actually impacting your mental health, right? And that's really important to know. I think for young people with all the stigma, they tend to sometimes, and maybe this is like that pendulum kind of swing, I think young people and adults, we minimize some of our stressors, or when something is actually past that usual stress line, we go, it's not really that big of a deal. There's way worse things going on in the world. I'm just kind of being over dramatic. Like this is just, everyone feels this way. Maybe part of TikTok is that pendulum swing to say, like, let's take everything super seriously. And I think we should take things seriously. And how do we talk about mental health in a way where we honor that, yeah, everyone has struggles that maybe impact their well-being. And like, maybe we're using mental health in like kind of conflating it with well-being rather than like mental health illness. I think those are two different things, right? Mental health illness and like, my mental health is going to struggle sometimes. One is like very broadly human. The other is something that impacts maybe when it hits that point of like really diagnostically impairing might be a smaller subset. And so I think we can, as like adults in young people's life, I think we can talk about the ways that we talk about those things and talk about maybe like wellness, talk about how things can impact mental health, but it's maybe not, doesn't mean that that's a facet of who they are. And there are some young people where mental health is a big, continuous, lifelong part of their life.
Yeah. So well said.
I have another thought on the coddling piece too.
Okay.
The coddling piece is, it comes up a lot maybe in like younger kids. There is, I think, this really important balance. And I think there's two extremes. One of let kids like cry it out, go to your room, I don't want to see you, I don't want to talk, right? And, maybe this like over kind of co-regulating to the point that like a kiddo doesn't start to learn to self-regulate. Like where is there something in the middle where it's not coddling, it's teaching when our brain's still developing and like co-regulating is really important. But how do we help young people from a young age learn to take care of their mental health, right? And I don't think that that's coddling. I think that's helping young people develop. And we also want to encourage some of the growth in that, right? We want kids to be able to build skills to regulate themselves. And how do we do that scaffolded over time and kind of step back and let them learn too?
Yeah, and I think what you're speaking to is this thing that I keep hearing too about the importance of warmth and structure.
Yeah, that's a great way to put it.
We need to, as parents ourselves, it's like we're really trying to understand how to navigate when it's important to connect and then correct.
Yeah.
In certain situations.
That's a great way to put it. Connect and then correct. I think, boundaries are always an important thing because kids want to know what are the confines I can work within. I think that's kind of a perfect way. And I think if we also think about it as all of these things that by the time we're adults, whether it's calming down, thinking through, like little kids don't have these abilities. Every opportunity is actually an opportunity for learning. And regardless of how we approach it, kids are going to learn something. And it's either going to be the things we want them to learn or things that are maybe not going to benefit them as well. So really, it's constant learning.
What's your advice to parents who are navigating raising young people in today's world?
My advice to parents who are navigating raising kids in today's world is to take their kids seriously. We don't want to, dismiss them because they're young or because their problems seem small comparatively. Like let's take them seriously. Let's create spaces where they feel heard. Practicing the skill of validation. Drop that into Google or YouTube today, like validation, and practice that. It's really showing someone that I hear you, I understand you, even if you don't agree, right? We can validate. We can say, a kid who doesn't study until last minute, takes a test and fails and comes home and is really sad and upset that they failed. We don't want to, validate it makes sense that, you waited till last minute and that's, things are tough. We might just say it's it's really hard not getting the things that you really want to work towards, right? We can validate something. We can validate the valid without validating the things that we don't want to reinforce, right? And that helps young people to feel heard. The moment that young people, especially young people with some of these sensitivity things we're talking about, or who are dealing with some tough times, when they feel misheard or feel invalidated, they shut down, right? So whether that is, and usually we don't do this on purpose, usually it's well-intentioned, like saying, don't worry about it, it's gonna be okay. But I just said nothing's okay and I don't feel okay. It might say, God, everything just feels like too much right now. Like just showing that like you can hear that it makes sense, why they're feeling that way makes sense. Even when we don't agree with the whole picture, we can find a piece of truth. And I think that's like a huge way of creating space, being non-judgmental, not labeling things. So when a teen, sighs and puffs and says something, with a particular tone, instead of saying you have a bad attitude, maybe saying, I'm noticing that like you're sighing, you're kind of huffing and puffing, you're squinting up your nose. Like what's that meaning? I'll tell you how I'm understanding it. So kind of instead of maybe calling names or labels, like again, how do we start to break down interactions? How do we provide a space where young people can share things? And how do we respond even to really hard things to hear? A young person's hurting themselves. A young person's thinking about wanting to not be alive anymore. Let's respond to that with a lot of compassion, but action to get them the support they need, as opposed to maybe reactions that are like, that's so selfish. Like, why would you think about, like, do you know how hard that would be for us, right? Like, while I see why parents go there sometimes, it's not helpful in that moment to say, that sounds like you're going through a really hard time. How do we get you help? And so I think creating some of these spaces that are non-judgmental, that can see and like validate and understand where kids are. And parents, I would say one big piece is taking good care of themselves. So getting a mindfulness app. Mindfulness we know is major for young people and parents alike. It's a key aspect of being aware of our own kind of reactions so that we can engage in like the most effective parenting possible without letting maybe our fear lead our parenting or our anger lead our parenting. Really, we can let kind of like the kind of best version of ourselves that recognizes what we're feeling, but also can like make some logical choices. And mindfulness can help us get there. So I would tell parents to like download a mindfulness app and like integrate that into like their daily practice.
Great. Can you speak to the importance of having a strong adult caregiver in a young person's life? Or it could be a mentor, a school counselor, somebody who's in that leadership position who kids can really look up to.
I mean, I think something, I probably should look it up, but it's something that I've been hearing forever, right? Since I started my training, maybe even before, that it takes one positive adult in a young person's life. And I don't know if that's just a saying now at this point. And I think there's a lot of truth to it, that having a positive adult in a young person's life is tremendously impactful. And I think, gosh, if any adult thinks back of who have been adults in my life since I was a kid that had a profound impact on who I am, we might be able to think of 1 to 3, and it makes a difference, right? And so access to these adults is really, really important for young people, whether that's at school and extracurriculars and sports and the neighbor, the person who's really nice at the corner store from your house, like whoever these people are, parents, grandparents, can have a profound impact on young people. And I think they're the people who create those safe spaces, who kids feel heard for, who folks make time for, who create that sense of safety, who don't make assumptions about who they are or what they are, who maybe even give them grace when they're a little rough around the edges. Especially right when we think about that trauma-informed piece of kids can be coming with a lot that we don't know about, and their reactions that might be a little rough around the edges really might have nothing to do with us. And so how do we persevere through that if we're in positions where we are potentially those one adults in their life who can really make a profound impact?
Why do you care about this work?
Oh gosh. Whew. I mean, we all have personal stories. I think I was a young person really impacted by mental health. I had a wonderful, loving family, in a lot of ways. There's always like, had my struggles too. And mental health wasn't something that was talked about, right? It was something I kept through myself for a lot of my adolescence. And I think about, and I grew up in a really rural kind of cow town. There wasn't access, right? And I think that context was like, you don't talk about it even more. And I think about what I know now, and like, if we can find a way to create access to where families can get care, they can get really good targeted care. We practice that care in a way where we get them the dose of treatment, and we can get more families in, and we can graduate families so they can get back to their like lives. And it could really have a huge difference. And I think those things would have a huge difference in my life. I think about some of the young people I've had contact with throughout kind of my profession, and when folks are given really solid care, and care that is based like in theory, in the evidence that we have, I mean, it has the ability at a young age, if we can intervene or intervene early, it can change the trajectory of their lives, of their relationships, of the things that they're able to do. I don't know, so that seems pretty darn important to me.
I also want to talk about community.
Yeah.
And youth being involved in their community.
Yeah.
Is it as simple as just having a community can be that, that much of a solution potentially for youth in today's world?
I would say yes, and when do we need those communities to be really structured and intentional? Belongingness is like one of those foundational things that I think we need as humans. Is we need belongingness, we need connection. We see those young people who are socially isolated really struggle for whatever reason, right? Whether they are targeted at school and harassed, whether they have particular developmental differences that make it harder to connect with folks. Like, belongingness is so important, and the lack of that is really hurtful. And so having community where that sense of belongingness is there is really important. And then again, some of the things we've talked about where young people are faced with like the realities of inequity in this world, even through, right, like elementary school through high school, they're feeling it. And at some points they're able to put names to it and recognize it too. Sometimes we need community that supports those individuals, right? How do we create community? And some schools do this, some community centers do this, right? For like LGBT youth, how do we create centers for young Black and biracial kids to like be able to connect among a number of identities, whether that's, again, a number of identities, I think is crucially important. And I think, especially if we think about thinking about like the disability community and young people who maybe have chronic health issues and they can't connect with their peers, I think some of the hospital clinics, sometimes they create these online ways that have been really incredible for young people to be able to connect because maybe they have autoimmune deficiencies and they can't be around others. The pandemic sure made that hard. So how do we think about creating access to community for all of our young people? And I think it's critically important, and we have to make sure that those communities are safe and inclusive.
What do you hope to see? Is there anything that gives you great hope? And I know this is a couple questions in one, but it's just sort of this like end cap of like, if mental health could look a certain way, let's say 5-10 years from now, what would that look like to you? I know that's a few different questions. But.
I mean, it's literally my job too, right? Mm-hmm. What I hope for mental health, like the trajectory of mental health down the line in the future, 5-10 years from now, is that mental health is integrated into more facets of our lives. So it's more integrated in schools where kids spend so much time. It's families are getting education, parents are getting education on how to care for like help with well-being and support, and maybe especially getting support with those young people who do have more complex mental health. It's really hard for caregivers to know how to navigate that, and can come with a lot of self-doubt and different things. So how do we provide those supports and create more access? How do we maybe even innovate within mental health and think about new ways of doing mental health? Is it just coming to the office once a week? Or can we start to think of things in a new way that expands that access? That telehealth, I think that's been one of the weirdly good things that came out of the pandemic is everyone got on board with telehealth. Prior to that, I had like 1, maybe 2 telehealth patients, and it just wasn't common. But now there's so much more room for access. So like having that, how do we innovate from there? How do we create opportunities for more mental health? We also have this, upcoming thing with like technology, right? And how's virtual reality being used? How is AI being used? And we're already seeing it in some mental health sectors. And again, that comes with some pros and cons we got to be really careful with. And if it's here, how do we use that to benefit and create more access? And so that's what I would like to see, is that those who want access get it. Are there ways we're able to innovatively think around getting around access with like insurance and things like that? Like, how can we start to reimagine what things could promote mental health and ensure that families can get in? And I think about one program that's here in our anxiety clinic. Dr. Ben Mullen created an OCD boot camp for 1 week, and it's this, some of my patients have done it and they love it, and they do field trips through the day, and it's all these integrated, playful, fun ways to face something that's really painful and hard. And so again, thinking about how do we make mental health work for young people and make it motivating, and because we're asking them to do some really hard stuff. And so I hope to see more of that. It's just engaging, there's more access, it's high quality, and it's integrated into more facets of life: school, home, primary care.
I'm sure you see a lot that can be terribly upsetting in your job. I'm wondering if there's anything that is just like uniquely beautiful that you think about in what you do.
Oh, so much that is uniquely beautiful, and like being able to be in a role to be with families and young people, caring for their mental health, their well-being, seeing young people come out of really dark places to excelling is, I don't know, they probably get tired of me commenting on it, because every time I see them, I'm just like, wow. Like, 2 years ago, you didn't want to be alive anymore, and now look at all that you've created, like this life that is really worth living to you. That's pretty incredible, right? To see young people and see families come through hard times, to connect in new ways, to feel like they have ways to move forward when they felt maybe really hopeless at some point. Because I know everyone is trying their best, and sometimes we get stuck at figuring out how we can do better, and get out of a stuck spot. So yeah, I think there's a lot of beautiful things that come from working like in the mental health field.
What did I miss? I'm sure there's a lot, honestly, but anything that you want to add?
How do we get our politicians to really prioritize mental health, to prioritize like political change that actually is having a trickle-down effect on young people? I think this is vitally important. And I think getting youth involved in that process, right? Giving them this sense of like they can have a say, they can participate in this. I think those can be really, really powerful things. Especially I think if there are things in, whether it's community, statewide, national-wide, if there are political things and political policies that are impacting young people directly, or the people they care about, how do we create some sense of I'm participating? And in some families, that's been writing a letter to someone who is really fighting for their rights. And that feels really good to a young person to write that and sign it. Doing a $5 donation together online. Like, what are some of the ways that young people can start to feel like, oh, I can have a say in this, when maybe certain policies feel like it's taking away like their agency. And I think that's something that can be important, that families can partner with their young person. Contributing can have a really big return, especially when it comes to, it's like a treatment strategy, right? Is how can I contribute when I'm having a hard time? It really helps us feel a little bit better.